As a radiologist, I'm very familiar with the situation in which a patient has an MRI scan requested, but then, for some reason, can't complete the study. It's very common, about 10 to 15% of the time, that a patient has an MRI scan ordered and due to a pacemaker or another active implantable device, claustrophobia, or some other contraindication, that we can't do the MRI scan. When the primary care physician or other physician orders an MRI, in my mind, what they're really asking for is a diagnosis, and they want an imaging test that will provide that diagnosis. MRI is an outstanding imaging test, but there are many other ways to get the diagnosis the provider is looking for. There are always alternatives available to MRI. Some of those alternatives may be less sensitive in certain cases, but in most circumstances, the alternative modalities we have to make diagnoses in the absence of MRI are quite good, and in many cases, equally good as the MRI scan itself. Multi-detector CT, in particular, has made tremendous advances in the last 15 years or so. The image quality is outstanding. With contrast media, either intravenous or in the joint or in the spine, oftentimes the image quality and the diagnostic power of multi-detector CT is absolutely equivalent to MRI, and sometimes it's better, especially in the presence of metal. So there are always alternatives to turn to if you cannot do an MRI.